Welcome, my name is Dr. Arthur Cho. I am the Medical Director for the Los Angeles Project for the Children's Health Fund and the Academic Director for Pediatrics at Cedars-Sinai Medical Center. Our presentation will be on immigrants and refugees and their unique challenges in facing medical care. As means of introduction, immigrant children face a variety of challenges, and it's important to understand the background behind this. Immigrants represent a significant portion of the U.S. population. They are a diverse group, including racial and ethnic minorities. They have higher rates of poverty with lower rates of English proficiency, education, health literacy, which make a dramatic impact on their health care. Immigrants face many challenges obtaining adequate health care, and they have unique health care considerations, including specific medical and mental health disease. Healthcare providers are central to understanding and addressing these challenges to improve the health care of immigrant children. So it's important to understand definitions when speaking about immigrant children. First off, immigrant children are defined as either being foreign-born or born in the United States who live with at least one parent who is foreign-born. This represents 1 in 4 children in the United States, or over 18 million children. Migrant children, on the other hand, are families who move across the country due to work. This is often due to seasonal employment. Unfortunately, these migration patterns make it difficult developing access and continuity with providers. Finally, border children are defined as living within 100 kilometers of the U.S.-Mexican border. This is often in border states such as California and Texas, and they live in fear of separation with other family members due to concerns of deportation. This is a graphical representation of the 3 high-risk groups. The first group of immigrant children is represented by the large blue circle. The second group, represented with the pink circle, are migrant children, and the third group are border children who live within 100 kilometers of the U.S.-Mexican border. As you can see, these groups overlap and are not mutually exclusive, but each of these groups have unique considerations in accessing healthcare. But what is common is that they all have challenges due to the nature of their immigration status. Our next slide is on epidemiology. All states are represented in housing immigrant families and their children, but 2/3 of immigrant families reside in only 6 states: California, Texas, New York, Florida, Illinois, and New Jersey. As far as their descent, over 40% of immigrant families come from Mexico, 20% come from Central and South America, another 20% come from Asia, and the rest from all other parts of the world. In looking at this graph, you can see that Mexico accounts for a large percentage of immigrants who come into the United States. And again, Central and South America, including the Caribbean, account for 20%, Asia accounting for 20%, which includes East Asia, Southeast Asia, and India, and the other areas around the world account for the rest. This graph represents how immigrants are distributed throughout the United States. California has the highest proportion, accounting for 26% of all immigrant families. Texas is second at 13%. New York is third at 8%. There are 22 states that have increasing proportions of immigrant families, and it's important to recognize. But in every state across the country, immigrants do reside, and we do need to understand the challenges that they face in accessing healthcare. This is a map of the United States, and each state is color-coded. Those that are darkest in color represent a greater than 30% percentage of children who have come from immigrant families. And as you can tell, they reside mainly in large states: California, Texas, Florida, New York, and along the border as well. In regards to the challenges that immigrant families face, there are 4 large categories that we need to be aware of. In regards to poverty, 30% of immigrant families live below the federal poverty level compared to 10% of non-immigrant families. As far as healthcare coverage, immigrant families have higher rates of uninsurance. 15% are uninsured, which is almost twice that of non-immigrant families. Due to their eligibility, it's unfortunate that many of these families qualify, but due to fears of deportation or them being unaware of these programs, unfortunately, their rates are higher. As far as language, they have lower rates of English proficiency, which prevents them from being able to access the healthcare system or be able to communicate effectively with their providers. It requires providers to have adequately trained medical interpreters to be able to communicate with these patients and their families. And unfortunately, immigrant children are at greater risk of language delays due to the lack of English proficiency. From an educational standpoint, approximately 30% of immigrant parents have no high school education. Low education for caregivers relates to low health literacy and unfortunately relates to poor health outcomes. When screening immigrant children, there are several concerns in regards to their medical and mental health needs. They have higher rates of undiagnosed congenital diseases due to lack of newborn screening, hearing loss and hemoglobinopathies, as well as inborn errors of metabolism can go unrecognized. Immunizations are at lower rates. Infectious diseases are at higher rates, such as parasites, tuberculosis, and hepatitis. They have higher rates of dental caries. Unfortunately, their nutrition is not maximized, so they can either be malnourished or overweight. There are many environmental exposures that are toxic, including lead poisoning, smoke and alcohol exposure. They can have also both unrecognized developmental delays and mental health disorders such as depression and anxiety. When screening immigrant children on history, there are several factors that are important to review. Their immigration status and basic information such as their country of origin and their time of residence. Their birth history is important to understand complications during pregnancy as well as perinatally acquired infections. Past medical history, including acute and chronic diseases. Medication and immunization status. Their nutritional history, including a thorough diet history as well as the risk for nutritional deficiencies. Environmental toxic exposures such as lead, smoke, and alcohol. Family history, including the presence of household infections or familial diseases. The social history is essentially important, including family structure, literacy rates of the caregivers, as well as education and screening for abuse and neglect. And that both developmental and mental health screening is important to uncover any underlying illnesses or diseases that may not be unrecognized. Screening immigrant children through the physical exam includes reviewing their growth parameters using the WHO growth charts for weight, length, and head circumference, blood pressure screening greater than 3 years of age or the presence of risk factors, vision screening greater than 3 years of age, hearing screening at newborn period as well as greater than 4 years of age, a thorough dental evaluation, a genitourinary evaluation for pubertal development, and a thorough skin evaluation looking for signs of infection such as scabies and lice. Screening for newly arrived immigrant children includes laboratory evaluation, a CBC to screen for anemia, lead level, hepatitis B surface antigen, screening for hepatitis B. HIV and syphilis is important, especially if the prenatal labs are good. Tuberculosis skin testing, given the risk of tuberculosis, and intestinal parasites, particularly if they are symptomatic, are important to evaluate for. It's important to understand the healthcare access challenges immigrant families face. Immigrant children are 2 times more likely to be uninsured compared to their non-immigrant counterparts. In regards to advocacy efforts, providers caring for children should advocate for health insurance coverage for every child as well as every individual living in the United States to ensure and optimize children's health. And we also know that children's health is dependent on their parents' and caregivers' health, which makes universal health care essential. Providing a medical home that provides comprehensive, coordinated, and culturally effective and continuous care is also essential. Being able to provide information to families, including the insurance programs as well as the other benefits, are also important so that we can help educate the families of the resources that are available to them. This is a table that represents the different services from insurance and programmatic services from Medicaid, CHIP, and the Affordable Care Act subsidies for your review. In summary, the AP recommendations for immigrant children include providers should advocate for healthcare insurance coverage for all children. A medical home should be established for all children, including immigrants. Providers should recognize the barriers to healthcare for immigrant children. Providers should be aware of their unique physical and mental health challenges. Providers should comprehensively evaluate the health of all newly arrived immigrants, including medical screening, immunization status, developmental and mental health screening. Providers should assess and review their educational progress and advocate for culturally effective early intervention services. Providers should be aware of available resources, including insurance and other benefits. Providers should promote diversity and inclusion for all backgrounds. So refugees are different than immigrants, and by definition, they are someone who has fled from his or her home country and cannot return because they have a well-founded fear of persecution. This is often based on religion, race, nationality, political opinion, or membership in a particular social group. In regards to unaccompanied minors, these are refugees who've sought asylum but are not accompanied by their parents or other caregivers. In 2015, the United States had 33,000 children seeking asylum, and the vast majority of these children came from Central America, Guatemala, El Salvador, and Honduras, making up for more than 90% of these unaccompanied minors. 3/4 of these refugees are adolescents greater than 14 years of age, and 2/3 are male. And it's important to understand their background so that we can help these children get resettled within the United States as well as deal with the persecution in their home country. And speaking more broadly, talking about more of the epidemiology, in 2015, a total of 70,000 people sought asylum and were successfully granted relocation in the United States. And these include both children and adults. In regards to those that were relocated in the United States, 35% came from the Middle East, 32% came from Africa, and 26% came from Asia. The problem with these children and their families is that they are disenfranchised and their health care is compromised due to a variety of issues similar to immigrant children. The solution is prevention, to identify persecuting countries and advocate for human rights within these countries, and finally to petition for safe settlement of these children and families within the United States. Okay, these are some resources that are available to learn more about the countries that are involved that are leading to persecution of their citizens and the refugees seeking asylum within the United States and other countries as well. These resources are available to help educate about the specific challenges that each of these countries are facing and to help us be able to better serve those patients who are seeking and being relocated within the United States. I want to thank you for participating in this presentation, and hopefully having a better understanding of immigrant and refugee children will help better prepare us to be able to provide more effective and quality care for these children and their families.